Today, we're going to talk about the subject and ask a very important question. Is lung cancer a problem in Nigeria? And we have two very important people here to discuss that with us. Thank you, Dr. Ogunleye and Dr. Habeebu, for coming on the program to discuss this very important issue with us. So if I can start with you, Dr. Ogunleye, can I ask you that question straight off? Is lung cancer a problem in Nigeria?
Thank you very much. Thank you for inviting me. It's a problem in our society. And virtually, something that virtually every week you see new cases coming up. And apart from the fact that in those days, you used to see people, before they develop it, they'll be in their 40s or in their 50s. But now, the age of presentation is lower. Just over the weekend, we lost a 22-year-old lady with advanced lung cancer. She never smoked. We used to talk of people who are smokers as being the ones who have lung cancer, but that is no more. We are now having people who never smoked who are developing lung cancer. And majority of virtually everybody, they present very late. They are in stage 3, stage 4 by the time they present. The mode of presentation is usually similar to tuberculosis. So apart from the fact that the quantum, the volume is increasing, the mode of diagnosis is also very poor. They present to general duty doctors, and they have to now present with tuberculosis, which is also very endemic in our society. So this patient is usually managed as a case of TB for long, for 5-6 months, even up to a year, before they now realize this is not responding, and then they now refer the patient to us. And by the time we see them, in most cases, it should have been advanced. So the volume is rising. And it's no more just ordinarily, the risk factor is no more limited to cigarette smoking. We are seeing people who have never smoked. In fact, there's a new concept of lung cancer in never smokers, and it is rising. The volume that we see per week is creating fear among us, we practitioners. That what actually could be causing.
Now that's very, very distressing to hear, because, as you said in the past, lung cancer, everybody thought was common amongst, people who smoke. And it was always thought that because we didn't smoke so much in Nigeria, perhaps lung cancer was not a problem for us. So can you tell us, what do you think are the reasons why there's such a rise in incidence, particularly among non-smokers in our own society?
Now, people are still smoking in Nigeria. So those who are smoking, they still have their own fair share of developing lung cancer. That has not stopped. That is still coming on. But the paradigm shift in this lung cancer story in Nigeria, like anywhere in the world, is that the quantum of people who have never smoked, who are developing lung cancer, the volume is increasing at an alarming rate. One, the age at presentation is lower. In those days, you used to see lung cancer presented in the 40s and the 50s. Now we are seeing people presenting with lung cancer in their early 20s. We just lost a patient over the weekend with lung cancer.
Yes,
okay, so
but what I'm asking is why? Why do we think this increase is there in non-smokers?
Now, no one particularly worldwide has been able to ascribe a single pathology to this. But it may surprise you to note that the females are more at risk of developing lung cancer in people who have never smoked. there's a preponderance of females in people developing this disease. And predominantly, the histological type of it is usually adenocarcinoma. So, but there's a lot of conjectures. Could it be because estrogen, the related from estrogen hormone-related activity in abnormal lung cells and all that? Could there be passive smoking? But then passive smoking could account for the volume.
So the truth is, we really don't know.
The passive smoking. So nobody actually has been able to pinpoint. Some have said, well, is it because of depletion of ozone layer that is causing it? Or what is it that they're eating? Or is it because they have again, nobody has been able to actually pinpoint what is causing it. But what we know is that we have a high volume of people who are coming up with lung cancer and they have never smoked. And to let the audience know, what is the definition of never smokers? These are people who have never smoked cigarette before, or who have smoked less than 100 sticks of cigarette in their entire lifetime. And a quantum of these people developing lung cancer.
Okay, thank you. So Dr. Habeebu, if I can just jump over to you and talk to you. You're an oncologist. Can you tell us, what is your experience with lung cancer? Is it just the primary lung cancers that Dr. Ogunleye is talking about that we need to be worried about, or is there more to the story?
Yes, thank you for inviting me. There is much more to this story. We are having a rise in the incidence of lung cancer, primary lung cancer. However, most of the cancers we see in the lungs are secondary cancers. That's the metastatic cancer from other cancer type, like the breast cancer.
Can you just explain what metastasis is for my audience who are not medical?
Thank you. So metastasis is the spread of cancer from a primary site to another site. So most of the lung cancer that we see are cancers from other sites that spread to the lung. For example, breast cancer can spread to the lungs, which is the commonest cancer we see in this environment. We also have a lot of sarcomas, bone cancer, soft tissue sarcoma spreading to the lungs. We have prostate cancer spreading to the lungs. So primarily, we see more of cancer that are spread from other organs to the lungs. However, we also see lung cancers in our practice.
Now, this is very worrying, because you see, when I had planned to talk about this topic, we wanted to talk about issues such as what are the risk factors that cause or predispose people, for example, to primary lung cancers. And is there anything anybody can do to stop them themselves from getting it?
Well, actually, cigarette smoking has been implicated as a primary cause of lung cancer, and alcohol intake also contributes to lung cancer. Exposure to radiation, especially at young age, can also predispose to lung cancer. The inhalation of chemical agents, chemical dyes, and waste products from industries can also result in lung cancer. Very rarely, other form of chronic irritation of the lungs and other form of benign lungs, can also predispose to lung cancer. Very low fragment of lung cancer are related to familial component. That's running in families. Most of the time, what you have is a mutation. That's a change in the gene that is triggered in the lungs that result to lung cancer.
Now, what about asbestos exposure? That used to be something that used to be spoken of before. Have we completely eliminated it, for example, in Nigeria?
We have not. Asbestos is also one of the factors implicated, asbestos, nickel, and other chemical, agents. That is why you can see that our roofing sheet, we no longer use asbestos. We now use aluminum roofing sheet. And most of the components like refrigerators and other components that we use asbestos for, we are replacing asbestos with other elements so as to minimize exposure to asbestos, because asbestos has been classified as one of the primary causes of lung cancer.
Thank you. Thank you very much. Thank you, Dr. Habeebu. I think that's very interesting what you've been talking about. And I'd like to just, clarify the issue of secondary smoking. What impact? Is it very bad or not so bad or moderately bad? How bad is the issue of secondary smoking, and in particular its cause of lung cancer in the poor people who weren't smoking, but who were exposed to somebody else's cigarette smoke?
Secondary smoking is very important. It's a significant factor as a risk factor for lung cancer. That's why you say in some developed world, you have places that are designated for smoking, so where they are excluded from the population, from the other people. We are not yet up to that here. We don't practice that here, but it's very significant, and it's important for us to know about secondary smoking so that we can avoid the act with unintentionally smoking and thinking that you are not smoking. So thank you.
But some people don't have a choice, particularly wives whose husbands are smoking. You ask them, can you smoke outside? They will shout and they tell you, this is my house. If you don't like the smoke, get out. What do? You
can advise your spouse to smoke in the toilet. And if your husband does not agree to smoke in the toilet, as much as possible, you can go to the other part of the apartment when your husband is smoking. But you can, peacefully advise that your spouse or whoever is smoking should do it either in the toilet or in the kitchen, where you not in this main room, not in the main living room, so as to avoid secondary smoking.
Has there been anything shown? Because I know it's been shown that secondary smoking really affects the spouse. But how about children, the young children? What effects does secondary smoke have on them when the father, for example, is smoking in the house?
Because the smoke and the toxic effect of the smoke, like that of the matured, of the adults. So it's more important to screen children away from secondary smoking.
Okay, so if we can then perhaps just go to Dr. Ogunleye. Dr. Ogunleye, we were talking about making the diagnosis. You spoke about, how diagnosis is made in Nigeria and some of the challenges that we face. Could you expatiate a bit more on it?
Thank you, ma'am. Now, before I start, let me just speak more again, just add more to secondary smoking. The secondary smoking is almost as dangerous as a passive smoker is almost as dangerous as a guy smoking. At cases of women married to smokers who eventually develop lung cancer, and meanwhile the man that smoked did not have it. I see have instances, and the good thing is that most of the cancers, lung cancers, really caused by squamous cell carcinoma and small cell lung cancer. They are central tumors that are usually caused by smoking. The peripheral tumors of the adenocarcinoma of this world, they are usually seen in non-smokers, which is commoner in women. So when you see a woman developing squamous cell carcinoma, I remember seeing a woman a couple of years ago, and by the time I saw it and I told the children, oh, well, this person is smoking. Oh, they said no. I said, no, she's smoking. This is cancer that is linked to cigarette smoking. Later, the now confirmed, oh, yes, that their father was a chain smoker. And lo and behold, the man was still alive. This man came, by the time she came, the man was attached to the right atrium, right ventricle, and then, of course, the patient died. And it's confirmed squamous cell carcinoma. So passive smoking is as dangerous as present smoking. So that is why whoever is going to smoke must not smoke where people are. And that's why government ban public smoking. And it is even more dangerous when you smoke near young people. Because as young age, with smoking, the DNA adduct that will lay the template for cancer is laid at a young age. So that is why it is important that we should avoid smoking at that, or passive smoking at that age. And two, when you smoke around children, you are encouraging them to smoke. They will take to smoking. Now, those who say weed doesn't cause cancer, how many people smoking weed live long to the age of developing cancer? Majority of them end up in mental home and all that. So that is why not much work has been able to follow people that for long. I mean, the quantum of cigarette smoking that will cause lung cancer. How many people are smoking weed for that duration? That is normal. So those are the things precluding following up. So smoking weed causes more acute issues, mental disturbances, social, than cigarette smoking. Now, in terms of mode of diagnosis, of course, the challenges that is there is that we're in a world where healthcare delivery in Nigeria is still very poor, just like in the developed societies. Patients present very late. There are few experts to manage it, even when they present to experts, because the presentation is similar to tuberculosis. Most people will think it's TB. And even by the time you diagnose it, it's not my portion. People still will not agree with you. They will still prefer to go to other houses, the other religious houses to seek cure. Because again, healthcare financing is an issue. To make a diagnosis, the best at the early stage, you need to do a CT biopsy. It costs money. And then now you make a diagnosis, you want to operate, it's a lot of money. To do a tracheotomy and do a lobectomy, if it's one that will need surgery. If it doesn't need surgery, if it's one that will need chemotherapy and radiotherapy, it's a lot of money. So most patients, they will initially take the rejection option and then go to other houses to seek cure, where we're sure they will not get it. And by the time they come back, the tumor is advanced, is stage 4. So there's a huge challenge in terms of presentation, late presentation, and mode of diagnosis in Nigeria.
Okay. So Dr. Habeebu, he's talked about late diagnosis, and by the time they come in stage 4, do you have much hope? Is there much that you can do as an oncologist to help them when they come that late?
When they come late, unfortunately, there is little we can do. What we do is palliative treatment. However, for people to come early, that's why we have this type of program to educate people so they'll come a bit more earlier. And I hope many more people see this program and they should know the sign, and they should wake up the instinct, and then there should be more higher index of suspicion. So when you have a lung issue,
particularly among the medical personnel, but at least for people who are listening, if there's somebody that's being treated for TB, no improvement, I don't know how many months would they be treated for before there's no improvement, before you now say, you know what, let's treat this as lung cancer, let's seek a second opinion. How long would you want them to wait?
Well, when we see lesions, when we see lung lesions, it's also good to do biopsy. You don't wait, you don't keep treating. For TB cases, within a week to 2, you will see significant improvement if you are using anti-TB. So for any TB case, 1 week, 2 weeks, there should be improvement, significant improvement. If there's no improvement, do a biopsy to check if it is lung cancer.
Okay. Dr. Ogunleye, do you have anything you want to add to that?
Yeah, Professor Habeebu is right. The TB Mycobacterial tuberculosis is a lazy organism. Just compared with anti-tuberculosis, you will see improvement within a week or 2. All right. So to our colleagues, when the patient presents with cough, that's more than a month, and there is or with hemoptysis, and there are no constitutional signs. There are no constitutional symptomatologies related to TB. No evening pyrexia, no night sweats, you know, and usually there is weight loss. And then you take further history of habits and the history of smoking. Suspect malignancy. But if you are not sure, okay, you put on a trial of anti-TB for a week or two and there's no improvement. So that patient should be referred or should have a second opinion for it to be investigated for lung cancer.
Now,
primary lung cancer.
How easy is it to investigate? You talk about bronchoscopy, you talk about lung biopsy, but how easy is that for people to find that in Nigeria?
Now, in LUTH, we have an armamentarium of diagnostic things to pick up this case as early as possible. Okay, we have one of the best bronchoscopy sets now in the country, provided by the hospital. All right, and apart from that, with CT scan, you see, modern facilities have made it much better, unlike in the past. Infection does not pay. You have cough for more than 2-3 weeks. Please present to the doctor. Let him investigate. You know you are a smoker. You'll be smoking for very long, and suddenly you have cough. That's it. 2-3 weeks. Come round. Let them screen you. Let them do bronchoscopy and see what is going on. These things are available, especially and it's available now in most standard hospitals in Lagos as well. These facilities. Go for a screening, and also go for yearly screening as well. We operated a patient, I think in February this year. It's a white lady, heart surgery. What did she do? She went for yearly screening, and she did PET scan, and they saw a solidity low, the one in part of the lungs. And immediately she came for surgery, and lo and behold, we did lobectomy, and lo and behold, his surgery came out as adenocarcinoma. But because the thing was caught early, there was no metastasis anywhere, no difference anywhere. So early presentation matters most. So if you know you are a smoker and you stop, even though when you stop, the disease does not necessarily throughout life, you should do yearly screening. Some talk of low dose CT scan. So you do it so that you can pick it up very early. If you pick it up very early, it's curable. We do the surgery, and then, or if it's when we need the chemo, we go for chemo radiation, and you can be sure of cure.
Better response.
So
if we can, sorry, I'm so sorry to have to interrupt you, Dr. Ogunleye, but time is already up. I've already received notice that our time is already gone, and I want you to give us a few last words for our listeners. Please, can you give us a few last words for our listeners?
Anybody that is coughing for more than 2-3 weeks, please go for screening. The cancer in never smokers, majority of them, they don't have cough. What they have is flank pain. Is that on the left or on the right? Because it's a peripheral tumor. If you have that too, go for screening. And if you know you are a smoker of very long, and now you are having cough, or even do your yearly screening once you are 50 and above, so that this can be presented early. And once that is happening, please present to the hospital. Thank you very much.
Thank you very much. Dr. Habeebu, your last words, please, quickly.
Yes, if you have symptoms like chest pain, cough, hemoptysis, that's coughing out blood, weight loss, an association, and you are being diagnosed of pneumonia that you are treating and is recalcitrant, or TB that is recalcitrant, know that lung cancer is there. It's a very formidable differential. So go for screening for lung cancer. The earlier it's caught, the better the results.
Thank you very much. That's a perfect rhyme. The earlier it's caught, the better the result. Thank you very much. It's a pleasure having you on the program.
Thank you for watching. Please like, share, and subscribe for new video updates.